Pizza, soups, or salad. All of these options taste amazing with white button mushrooms. Portobello mushrooms are amazing in Italian sauces, and shiitake mushrooms are great in Chinese cuisine. There are plenty of mushrooms for consumption, and many more for consumption. All around the world, more than 200 species of fungi produce psilocybin, a naturally occurring psychedelic prodrug. Prehistoric murals and rock paintings in Spain, Mesoamerica, and Algeria depict psilocybin's usage in spiritual and divinatory ceremonies. In fact, after psilocybin is converted to psilocin by the body, sensory altering effects similar to LSD or DMT can be felt by the individual. Sensory alterations, commonly referred to as hallucinations, are caused by decreased thalamic activity. Psilocybin actually strongly binds to the serotonin 2A receptors within the thalamus and cortex of the brain, reducing their activity. Interestingly, the intensity, duration, and the effects of psilocybin vary according to multiple factors such as mushroom species, dosing, the setting in which mushrooms are consumed, and a person's physiology. Generally, serotonin receptors in the brain are affected for 2 to 6 hours by psilocybin. It's generally considered of low toxicity. For example, a 60 kilogram person would need to ingest 1.7 kilograms of fresh mushrooms to reach lethal dose. Despite low toxicity, here are just a few adverse effects noted: tachycardia, hypertension, hypotension, headache, confusion, euphoria, muscle weakness, hallucination, panic attack, derealization, illusion, synesthesia, convulsion, alterations of thought and time sense, anxiety, agitation, transient hypoxemia, nauseas, acute renal failure, mydriasis. Some fatal accidents have been even reported due to strong emotional destabilization or even hallucinations that predispose a person to risky behaviors such as the ability to fly. In 1959, Albert Hofmann from the pharmaceutical company Sandoz isolated the active compound psilocybin. The company then marketed and sold pure psilocybin to physicians and clinicians worldwide for use in psychedelic psychotherapy. The 1960s weren't conducive to psychedelic research, but its popularity in spirituality and its recently discovered safety profile and non-addictive effects make it an interesting therapeutic opportunity in psychotherapy.
During the 60s to the 70s restriction on psychedelic studies, most researches were small-scale and used inconsistent methodologies which made their results doubtful. Thanks to the interest in the neuropsychiatric effect of psychedelic, the National Institute on Drug Abuse worked with the Food and Drug Administration to allow the continuation of research on psychedelic agents in 1992. In these times where mental health represents a great public health burden, a lot of scientific evidence suggests that the administration of psilocybin alongside psychological support produces beneficial antidepressant effects in patients suffering from major depressive disorders, treatment-resistant disorder, or similarly, anxiolytic effects for patients suffering from anxiety and anxiety-related disorders. Although the results of many studies looking at the therapeutic benefits are optimistic, we must not jump to the conclusion that a miracle cure has been found for mental health disorders. Many more studies are required on the effect of psilocybin. A typical flaw in studies illustrated in this phase 2 clinical trial is that study design only included about 100 participants. Larger scale studies are required, as well as a rigorous methodology to properly assess the safety and the efficacy of psilocybin.